Yes, okay.
Let me know when you're ready to start, both.
You going to record this?
Yes.
You have recorded it, right, okay. Okay, well, I haven't got your briefing. All I've got to say is that I'm aware of the impact assessment. That's the biggest thing, isn't it?
Yes, yeah, that's right. Make sure that, you're all aware and happy with the various impact assessments.
You've all read those first before we've done anything else, Tammy, so you're okay. All right, welcome to the Centre Social Healthcare and Wellbeing Cabinet Board. We need to appoint a chair, which is me. Perhaps, Tammy, you can do the roll call, please, and welcome.
Certainly, Chair, thank you. Excuse me. So we have councillors Peter Richards.
Present.
And Alan Lockyer. And also Councillor Charlotte Goldsworthy.
Present.
Thank you. I seem to be losing my voice this afternoon, excuse me. Officers Andrew Jarrett.
I'm present, Tammy.
Thank you. Angela Thomas.
Present, Tammy.
Thank you. John Hodges.
Present, thank you, Tammy.
And Nadine Jones.
Present.
Thank you. I believe that's everyone. Have I missed anyone off? No, there we go, Chair, all done.
Okay, thank you, Tammy. Right, so item 3 is the Chair's announcements, which we've decided I'm going to just say what I've said. 4 then, declaration of interest. Are we any declarations of interest?
No declaration.
Great, thank you. Moving on then to the minutes of the previous meeting. We'll take those, page 3, page 4. I think the last one is page 5, I believe. And then page 6, sorry, is the last one. Any issues with those minutes?
It was just a comment from Councillor Woolcock regarding the notation, which Nadine picked up.
Oh, sorry, yes, okay.
I believe that was in reference to the scrutiny committee minutes, Chair.
Scrutiny, sorry, Tammy. Okay.
That's no problem, thank you.
Okay.
Yeah, great, okay then, so we have a proposition that the true record?
Correct.
Great, okay. Moving on then to 7, residential and non-residential care charging policy. Anything to add, Andrew, was that?
No, just Chair, apologies that we have to defer this. Can I thank John Hodges for his interventions? I think his advice was, let's make sure that we get the policy right, and it is more specific as regards to linking it to the actual legal basis upon which we're making the decision. So, John, that's right, isn't it?
Yes, it is, Chair. I looked at it and read through it, and whereas I didn't find anything which was legally wrong, I was concerned that the way some things were wording might provide an opportunity for challenge because it didn't really quite reflect some of the wording. And so I gave that advice to Andrew that unless it was vital that some decision was taken today, we should rephrase it, though not changing the underlying principles, simply to make it clearer and less open to challenge.
Good, that's fine. And if it's not absolutely essential, it's done today, that's fine. It's best to get it right first. Thank you, John. That's good advice. Thank you. All right, then. So the recommendation, so moving on to item agenda 8. Okay. Any additions to this, Andrew, or is that?
No, I think it was given a good airing at scrutiny, Chair. I stand by the report and endorse that for you.
Good. Strangely, I felt like there was a bit of dissension about the co-working. I don't know why. This is a good strategy and a good work. Pete, you've got your hand up, yeah?
Yeah, I just think co-production has been around for many, many years in different guises. And I think, Andrew, you managed it extremely well, to be honest. I've got my views on co-production and the way it's been presented forward over many years. But I think, you summed it up in as much as this is a working document, and I said it in the meeting, something that gives us an opportunity to look at and evaluate and go through on a regular basis. Yeah. And probably I would put it, I wouldn't say it's the same, but I would say when we go through impact assessments, when we do documents and notes, I think it's been, going to go more that way, where we need to be assessing better when we're actually making decisions. So I can understand the emotions and the feeling of some of the members, because I think it's been a buzzword for so many years. I know the chair today has got her own views on it, and we've discussed them on other occasions. But I think it had a good area, Andrew, like you said, and I think, you know, we got to work with it and take it forward and take the positives out of it. Thank you.
Yeah, Andrew?
Yeah, just to reassure you, Chair, so the fact that we are trying to work in a co-productive way will not have an impact on the quality of negatively on the quality of the work that we're doing, and we will undertake to provide, you know, where we can, the numbers where we're co-producing, and we will feed back to both scrutiny and yourselves about how that's going.
Excellent. Yeah, and I think it's healthy that there was a good discussion, as Peter said, and that you know, obviously we're not just putting things through on the nod. That you know, people are concerned and willing to dig deeper to find out exactly what's going on. I think it's a healthy debate. It wasn't in any way detrimental to the cause. And we're moving on with that. Then the recommendation is on page 33, which is given due regard to the attached integrated impact assessment. It is recommended for members, etc. Is that okay?
Move, Chair.
Move that. Great. Okay then. Right, Tammy, that's that one done. And then we've got item agenda 9. I think that's just for monitoring, I believe. Yeah.
Correct.
That's correct.
Just
All right. Okay. So then we've got 10, which is any additions to that, Andrew? Is that or anyone?
No, I think that huge amount of work being done around carers. I think it was well supported by scrutiny, and quite rightly.
Yeah, and about time too. I think the carers have been well underrepresented for so many years now. It's a good welcome to the committee. Okay, then with that, recommendations on page 109 going on to 110. So again, given due regard to the attached integrated impact assessment, etc., and the 5-year West Glamorgan regional carers, are we willing to see that through, Pete?
Welcome, and I move, Chair. Thank you.
Excellent. Well done. Good. I mean, not well done for you. Well done to everyone who's put it through. I think approving it is quite easy, isn't it? Okay, good. Right. Well, I think that's probably all we've got. I got no urgent items. I just want to get my iPad to work. No, so no other item agendas. 10 was our last one. Nothing like urgent. Is that okay, Tammy?
Yeah, thank you, Chair. Yes, thank
Nobody
you.
else got anything? I'm not trying to prolong it. I'm just asking. Right. Good. Excellent. Okay, then. Well, thank you all for attendance, and we'll see you again soon. Thanks.
Thank you.
Ta-da.
Bye.